Guys, this is Preeti and you're watching Meta Solution. In this video, I'll be teaching you about the hyperplasia. Hyperplasia, which is an important question for 5 mark and 3 mark also. For 3 mark, they'll ask about the examples, and the 5 marks, it is important for as a definition, and the types are important. I'll be teaching entirely about the hyperplasia. The definition is increase in number of the cells in the organ or a tissue, which leads to increase in the size of the organ or a tissue. Either this increase in number may be either due to the division of the differentiated cells already, which has differentiated cells, or only in few cases this is due to the less differentiated progenitor cells. This is the definition of the hyperplasia: increase in the number of the cells in an organ or a tissue, which leads to the increase in the size of an organ or a tissue. Either this increase in size because of the cell division of the differentiated cell, or few cases it may be less differentiated progenitor cells. This is the definition of the hyperplasia. And the causes will be physiological causes and pathological causes. Physiological causes means it occurs in everybody, every people, and naturally it occurs. That is physiological hyperplasia. Examples for this, there are 3 hyperplasia examples for physiological hyperplasia. That is breast at puberty, pregnancy and lactation. That is hormonal stimulation. There will be hyperplasia of the breast at puberty, pregnancy and lactation, and there will be hyperplasia of the uterus at during the pregnancy. This is an estrogenic stimulation. These two are estrogenic stimulation. And other example will be, this will be hormonal hyperplasia. Examples for hormonal hyperplasia. And examples for compensatory hyperplasia is during the partial hepatectomy, the part of the liver has been taken out. Then the stem cells which are present in the liver, they'll proliferate and forms a other part of the new liver. This is an example for compensatory hyperplasia. These two are physiological. And now we come for the pathological. Pathological, this is due to the excessive endocrine stimulation. Hormonal stimulation, there will be estrogen hormone more, that leads to the endometrial hyperplasia. And benign prostatic hyperplasia, this is due to the stimulation of androgen hormone. Here endometrial hyperplasia because of estrogen, then benign prostatic hyperplasia because of the hormone androgen. And during a few cases, the patients were given estrogen therapy. That is in case of prostatic cancer and cirrhosis of liver, we give estrogen therapy. This estrogen therapy, in case of cirrhosis, there will be liver will be undergoing cirrhosis, so it has lost its capacity of metabolizing. It do not metabolize the endogenous estrogen, so this leads to the estrogen accumulation. Estrogen in males, it causes gynecomastia. That means that is development, enlargement of male breast usually rudimentary, still they undergo enlargement of the male breast, that causes that is called as the gynecomastia. This occurs in a male who has undergone estrogen therapy for prostatic cancer or cirrhosis of liver. These are the pathological examples. And other case will be, you have seen keloid. Keloid is a hyperplasia condition when there is a long standing inflammation, that is when chronic inflammation will be there, then hyperplasia of the skin or the mucosal membrane occurs. This example for this is keloid. And hyperplasia will disappear when the signal subsides. Hyperplasia disappear, but if it doesn't disappear, then it leads to the cancerous condition, that is neoplasic conditions. You can see the endometrial hyperplasia can develop into endometrial cancer if the signal has subsided. Still there is a proliferation that leads to the endometrial cancer. The mechanism how it happens means the already differentiated cells, or a few undifferentiated less differentiated progenitor cells undergo replication. Cell proliferation takes place of the mature cells, which are stimulated by the growth factors. So when growth factors or growth hormone comes and acts on these cells, they start proliferating. This is a mechanism. And newer cells may be derived from the stem cells or less differentiated progenitor cells. The gross features will be, the organ will be increased in size. The organ will be increased in size, and number of cells and the mitotic figures will be increased in case of hyperplasia. Hyperplasia, you can see example, benign prostatic hyperplasia of the this is a urinary bladder. This is a prostatic gland. Normal prostatic gland. This is a urinary bladder. This is the prostatic gland. Normal prostatic gland size will be like this. There will be increase in the number of cells because of this estrogen therapy. They may undergo benign hyperplasia of the prostate. This is an example. And hyperplasia hyperplasia occurs in capable of replicating cells, that is stem cells. In case of permanent cell, hyperplasia cannot occur. It like occurs, hypertrophy will occur in permanent cells. Pathological hyperplasia leads to the cancerous condition. Benign hyperplasia of prostate because of the hormone, not testosterone, dihydroxytestosterone. Hormone stimulation is dihydroxytestosterone. Hyperplasia not like neoplasia. If the stimulus is the subsided, it stops. The proliferation stops. Whereas in case of neoplasia, even the stimulation is subsided, still there will be proliferation. This is all about the hyperplasia. If you find this video helpful, please do like, share and subscribe to my channel. Thank you.